All right, thanks everybody for coming back promptly from lunch. I want to start by introducing our first speaker for the afternoon session. Tom Webster is Professor of Environmental Health at Boston University School of Public Health, and he holds a BS from MIT and a Doctor of Science from BU. His main current research interests include PFAS and the health effects of exposure to mixtures. He has co-authored more than 30 publications on PFAS, spanning questions of exposure, toxicology, and epidemiology. And as just a fun fact, several of the speakers at this meeting were trained by Tom at Boston University School of Public Health. So Tom will be presenting on the relative importance of PFAS exposure sources for the general US population. Thanks, Tom.
Okay, thank you very much. Let's see. Can everybody see the slides? Yeah?
Looks good.
Okay. All right. Well, thank you very much for having me. It's actually nice to see some of you, even if it's not in person. And thanks for the introduction. So, the usual thing, I don't have any conflicts of interest. All right. So what am I going to be talking about today? Several different things. First of all, which PFAS exactly are we talking about? Something about methods for investigating exposure to PFAS. I'm going to touch briefly on some of the major exposure routes, water, diet, and indoor exposure. Kate Hoffman will say a little bit more about indoor exposure and water. And then I'll finish up by really talking about the relative contributions part. All right, so what PFAS are we talking about? So this is a variation on the slide that Anna showed. And it's just, again, to underline what she said, there's substantial amounts of unidentified organic fluorine in human blood, environmental media, and consumer products. And I really like this idea of using extractable organic fluorine and then targeted analysis to look at mass balance. And this is something that, as Anna said, we're collaborating together to try to figure out what some of this unexplained stuff is in human blood. And really, I think the question I'm interested in is, what is this unexplained stuff? Is it PFAS that we're not measuring? So for example, due to lack of standards, because for most PFAS, we don't actually have analytical standards. And there was a very interesting case about this, about a compound called C604, that if someone wants to ask me about it later, I'll tell you the story about that. Or is it something else? The answer likely depends on the media. So for example, in wastewater, there's some nice work out of Rob Letcher's group showing large amounts of side chain fluorinated polymers in wastewater. In human serum, again, we don't know. Some of it is probably pharmaceuticals, but there may be other things in there. And it depends on the definition of PFAS, as someone mentioned earlier today. So this is actually something that I got interested in a while ago, and I have a student writing a paper about this that she presented at Fluoros last month. And we found at least 8 different definitions of PFAS that are sort of out there. There's the Buck et al. Definition, which you don't have to read all this, you can look at it later. It's the one that California Biomonitoring uses, and it essentially, the key thing, it has to be aliphatic, and it has to have one of these CF3 groups on it. There's the OECD definition, which was revised, let's see, this year, that Anna mentioned. And at the minimum, it has to have a CF2 group where the carbon has 4 bonds. 2 of them are fluorine, and those other 2 bonds are not a hydrogen or some other things. And just to mention, there are other definitions. So, for example, there are several state laws that use the definition of fluorinated organic chemicals containing at least 1 fully fluorinated carbon atom. So to my mind, this is actually ambiguous and potentially much broader, because it depends what you mean by fully fluorinated. So if what you mean by that is the hydrogens have been replaced by fluorine on at least 1 carbon, which is what is usually meant, then that could include a benzene ring that has a fluorine on it, right? Because you've replaced the hydrogen. So the problem is you're not saying anything about the bonding of the carbon. And that is a much, much broader definition. So just an example of the implications of this is the chemical structure of Prozac, which you've heard of, very commonly used drug in the United States. And it has this fluorinated methyl group up here, and it would be included under the OECD definition, but not under the Buck definition, right? Because it has aromatic rings, it's not aliphatic. And I think part of the point here is that, you know, to my mind, definitions can't actually be right or wrong. But you can ask whether they're clear or not, and you can ask what is the purpose of the definition. Is it for descriptive purposes? Is it for regulatory purposes? Is it for surveillance? And it all sort of depends. And so whether you want to include drugs like Prozac in your definition or not sort of depends on what the purpose of the definition is. We could have a very interesting discussion about that. All right. So the caveat about my talk is that when I'm discussing exposure to PFAS, I'm talking about what most people mean by this, is it's usually legacy PFAS such as PFOA or PFAS for which there are actually data, okay? I'm not talking about exposure to Prozac. All right, so how do we go about figuring this out? So again, PFAS is sort of a very interesting situation because we're mostly using serum or plasma. Some people have used urine for biomonitoring. And we are interested in the persistent compounds that we actually target, for example, PFOA. And that can result from either stable compounds or precursors. That's the external exposure. And then they are modified by pharmacokinetics to give us whatever we see in serum or urine. So you all know this. And again, biomonitoring integrates different exposure routes. You can't actually tell per se from the biomonitoring where it came from, because it can come from diet or water or indoor environment or other things like personal care products. And so what you see, say, in blood is the resulting combination of whatever was in those environmental media, things like behavior, human behavior, which connects those to exposure, and then toxicokinetics. So we really have two primary methods, and I'm going to illustrate these for water. One, I'll call it the epidemiologic approach, because I actually think it is an example of epidemiology. It's just that the biomonitored chemical is the outcome of interest, not a disease. And so what you do is you essentially regress serum or blood or whatever PFAS concentrations against water concentrations for water, okay? And you can do the same kind of thing for diet or dust. And the other is the exposure factor approach, where essentially you take water concentrations that you measure and you multiply it by a water consumption rate that you get from the EPA's exposure factor handbook, or you ask people or whatever. And each of these approaches sort of has its strengths and weaknesses. And we could, I've done lots of work with both of them, and we could sort of talk about those as well. I should say there are two other things that are used, maybe not quite as much, chemometrics. So this was mentioned a little bit earlier. There's been a handful of papers, a pretty good paper by Elsie Sunderland's group, using principal component analysis, sort of a fingerprint idea, and do the patterns of the different PFAS that you measure in blood tell you something about the sources. So I think this is a good idea. I'm not sure PCA is the right way to do it, but there are lots of ways to think about this, and it's a good idea. The other is reverse dosimetry, and essentially it's using pharmacokinetic models to try to estimate exposure from what you see in blood, or the other way around. You try to estimate what's in blood from your exposure, and then you can compare the two and try to say how much of the what you see in blood is explained for by the exposure route that you're looking at. And that's been used a fair amount. There's, again, lots and lots of details in that, and we could talk about that at great length. All right, so let's say a little bit about the major exposure routes that have been investigated. So water, I mean, I'm sure you're all very familiar with this, and I would consider this, at least for the main PFAS, as sort of established science, that if you live in a contaminated area, you're very likely to have increased levels of PFAS in your blood. And, you know, I worked on a couple of these studies, in particular, one with Kate Hoffman that you'll hear about later in the C8 studies in the West Virginia, Ohio area. And what we found is that water concentrations of PFOA in drinking water predicted serum levels near the DuPont production facility there. And you can actually use regression to estimate the increase in serum concentrations per unit increase in water. And what we found is that those were actually consistent with the pharmacokinetic estimates, which is very nice. And I think this works pretty well, and this has been done in a number of places now. So we know that at least in contaminated areas, water can make a very significant contribution to what we see, what we biomonitor. The next one I'd like to talk about a little bit more is diet. Okay, so I think someone said earlier today that diet's one of the major routes of exposure. This is certainly what a lot of people say, and we can talk a little bit about the evidence basis for that. There are several US epidemiologic studies of the kind I mentioned that found that diet was significantly associated with blood levels. So just two of them, I picked these two because I worked on them and I know them in boring detail. There was one that we did with blood samples back in the late 90s, and we found associations between various PFAS and things like fish. So you've heard fish earlier today. Shellfish, meat, poultry, these were all associated with the PFAS plasma levels that we targeted. Another study that we did a long time ago using NHANES data, we found, again, in NHANES, they use dietary questionnaires, and red meat consumption was associated with PFAS and PFNA concentrations in blood. And then when we looked at fast food, either total calories from fast food or fast food items eaten per day, that was associated with changes in PFOA level. And so that actually begins to suggest that there might be some differences between the different PFASs, whether they're from possibly food packaging or whether it's a bioaccumulation process. And it's probably both going on with PFASs. So there's actually, I would say, quite a number of studies now that have used this sort of design and have established that diet is significantly associated with blood levels. Now, the last one I'll mention a little bit, and Kate, I think, is going to say a little bit more about this, is sort of indoor exposure. This is much less studied than diet or water, but there are now sort of a small number of studies that have, again, using this epidemiologic approach, found that serum concentrations or plasma are associated with concentrations of the more volatile types of PFASs found in air. So, for example, fluorotelomere alcohols. Whereas the levels in concentrations in serum were not particularly associated with dust concentrations from people's homes, or very weakly. So as an example, the kind of data that we found, changes in serum PFAS level in people's blood compared to these phosas and phoses. These are so-called PFAS. So they degrade into PFAS and they get these nice relationships. This is from pregnant women in Vancouver. And then again, from the same study, we found that levels of PFOA and PFNA in serum were related to tertiles of one of the fluorotelomere alcohols. Again, another precursor. I would say one of the things I was interested in, I don't know if I was surprised or not, is that the DIPAPs, which were huge in the dust in these people's homes, were not particularly related to levels in blood. So it's very interesting. And then finally, I think an even less studied area has to do with personal care products. And there was this very nice paper out of Stockholm University a few years ago, and there's been a couple more since, where they've looked at PFAS in, say, cosmetics. And what they found was high levels of total fluorine, somewhat less levels of extractable organic fluorine, and then even less identified PFAS. And there's a potential for high dermal exposure. I would say we know almost nothing about dermal absorption of PFAS, as there's just a handful of papers out there on that. I think unless there's new ones, they may all be about PFOA. So this is sort of a big unknown. Potential important source, it might be related to things like sex differences in some ways, but we just don't know very much about it. All right, so let me turn now to relative contributions. So there was a nice paper, again, out of Elsie Sunderland's group, and they used really, it was clever. They used stored water in serum from the nurses' health study dating back to the late 80s. And what they found was that tap water, PFOA, and PFNA were significantly predicted plasma levels among high consumers of water. And they were able to estimate using pharmacokinetics that they got something like 12–13% of what they measured in blood could possibly be explained for by water exposure. And there's a few more data points in there, but this is one of the few studies I know of that has used empirical data like an epidemiologic approach to try to estimate this. So relative contribution estimates, other than that one I just spoke about, almost all of them use the exposure factor approach. In principle, you could do it either way, the epidemiologic approach or the exposure factor approach. Most of them have used the exposure factor approach, and those have very substantial uncertainties. I would say particularly the dietary ones, because it matters a lot where you sample food and how you measure it. So the detection limits are usually not very, the levels in food are not very good. It's hard to measure PFAS in food. And so it starts to matter a lot how you treat non-detects. You have to think about whether you're measuring precursors or not, because we know precursors are very important. You have to think about conversion rates of precursors into the stable things we see in blood. And then if you start moving out of diet to other things, if you want to look at indoor exposure, inhalation rates we know pretty well, but dust ingestion rates are really terrible for adults. We don't know that very well. And as I mentioned before, dermal absorption, really flux through skin, is very poorly understood for PFAS. And I don't necessarily believe very many of the models that are out there, because PFAS are just sort of weird chemicals. This is a table that is too busy. It comes from the review paper that we put together earlier this year, but there's a column here for percent exposure via diet. I mean, basically the takeaway is that diet is the main source. There are only 2 of these studies that are US, and they're about, what, 10 years old now? And they were from Matt Lorber, if you remember him. And he estimated in these papers that PFOA and PFAS were about 60 to 70% of exposure was due to diet. But again, I think these are very uncertain. Diet's important, but I'm not sure I really believe these numbers. And they're old too, and things change over time. Okay, so how can we sort of summarize that? Well, I think we have empirical data, from the sort of epidemiologic approach that water, diet, and indoor air all predict blood levels of some PFAS in some populations. And it's going to vary by population and person within the population. That water is very important in contaminated areas, and there's some reason to think, based on old data, that it accounts for something like 10 to 20% or something like that in general populations. That's actually important when you set water quality standards, that you need to have some factor to account for how much exposure is coming from other stuff, as I think Tom mentioned earlier. That diet is generally thought to be the major route of exposure in general populations, but I think that it's very uncertain, and we don't really know very much about diet. So this is underlined by a comparison of the recent studies that came out of the European Food Safety Authority, and just this last year, a study by FDA of PFAS and diet, and they kind of reach very different conclusions. So I think we need a lot more work on diet. And again, we know almost nothing about personal care products at this point. So we really need comprehensive exposure studies, and this is going to require intensive sampling to really figure this out. A little bit more relevant now towards what California Biomonitoring can do. I think it's important to think about, we were talking about trends earlier and what they might imply. So fast consumables like food packaging and cosmetics, as some PFAS get phased out of those, there should be rapid changes in exposure. There'll be slow consumables like furniture and carpet that may take a long time to work their way through the system. Meanwhile, we have global distribution of persistent and mobile PFAS. So there's kind of a worldwide background exposure that these signals are on top of. And so I think that part of what that will mean is that for diet, is a shift in food packaging. It may imply that bioaccumulation routes will become more important for some of the legacy PFAS. And very important, and this was touched on before, that when we start looking for trends and how they respond to interventions, that external exposure may decline much faster than serum, because a lot of the PFASs have long half-lives, so you have to build in the right kind of lag structure. So I think scientifically, we need to understand a bunch of things like unidentified organofluorines. I'm really interested in that. I think we really need to do more work on dietary exposure and indoor exposure and dermal exposure. That I think we still don't have a very good handle on real relative source contributions. I think we know a lot of the important ones, but the relative contributions, I'm not so sure. And that this is a rapidly changing world, and we need to have exposure studies addressing the changing production out there. Someone did ask me to say a little bit about food, because it gets asked about a lot. It seems to be at least a combination, or it was a combination, of bioaccumulation and food contact materials. And so you can imagine things like in fish, the persistent PFAS can accumulate in the fish, or things can come from farming. Food processing, we know almost nothing about. I'm sure there's contamination in food during food processing, but this is a huge hole. Food contact materials, we do know a little bit about. There's a little bit known about the effects of cooking, and then we have exposure. So what exactly is going on with diet depends on all this stuff, and it probably depends on the food and the type of PFAS. It's worth noting for the general audience that Teflon pans themselves are generally not considered to be a major source. The problem with Teflon is more making Teflon rather than using it. And again, that food processing is not very well studied. All right, I'd just like to end with some thoughts on what I think a biomonitoring surveillance program like that in California, which is really good. What can they do regarding PFAS exposure? Well, they're public health, and some of these things have been touched on before. We can, I think you can point out, because you have location data, you can potentially point out when exposure to water in contaminated communities is connected to blood levels. And the science behind that is pretty well established at this point. You can try to monitor time trends, both up and down, and evaluate interventions, although again, you have to think about lags with the compounds with longer half-lives, and you can certainly look at as disparities. So Kathleen mentioned several of these. In terms of research, there is a good precedent for using surveillance methods like NHANES to try to look at exposure. And I think with the questionnaire data that you do have, you can look at some of the non-water sources, such as consumption of certain foods or use of carpet. I think you have questions about carpet. There are important limitations. I mean, dietary questionnaire data is notoriously hard, particularly with time lags. And so you have to think really hard about that. But remarkably, it does seem to work sometime. And there are, of course, other problems like about the precursor. And then finally, I do think the chemometric fingerprint approach is worth doing. It's not super straightforward, but it is worth looking at. So let me just end by, I'd like to acknowledge a whole bunch of people I've worked with. And again, some of my current and former students who have worked on PFAS, and so in particular, Kate Hoffman, who you'll hear from in a minute. All right, so thank you very much.
Thank you, Tom. I really appreciate that overview and a summary of the questions and what's clear and what's not. We have time now for, we have about 15 minutes for questions from both the panel and the audience before Kate Hoffman speaks next. Any questions from panelists for Tom? Tom.
Hi, Tom. Very good. I really enjoyed the presentation. Doing great work. I guess I would still, these different methods for, I think we're always going to be limited on our understanding of some of the complicated relationships. There's just too many factors that come in. So, I think unless we really can go into people's homes and observe like what products they're using, what carpets they have, what they spray on their carpets, it's just going to be really hard to sort this out. So I do think I'm kind of interested that you suggested some methods that are sort of kind of inverse modeling or principal components. And I don't know if you could talk a little bit more, especially like if we start getting some really good pharmacokinetic models. And again, it would have to be, the class is not going to behave the same way. So we probably would have to have it for individual specific chemicals. But, would that maybe help sort out some hypothesis testing about food with some questionnaires more than just sort of brute force questionnaires? I think it's going to be important to have a little bit better pharmacokinetics, but I also would like your thoughts on that.
Yeah, I agree with you. I think to really sort this out, we would have to do very detailed sampling. And I don't know of any way to fund that in our current world, because we don't have an exposure study section at NIH, right? So anyway, Yeah, I mean, the pharmacokinetics, we could have a long discussion about that. I mean, what people typically do is something very simple-minded, which is assume first order pharmacokinetics and steady state, which is wrong. And then you have to estimate half-lives, which we have pretty good estimates for, but we have to have volume of distribution. That we don't know very well. We have to usually extrapolate. And it depends a lot on binding to albumin. I mean, it gets really complicated, but they do work sort of okay for at least a handful of the long-lived compounds. So I think it's not a bad. I mean, I think it's not a bad approach. I do like what Matt McLeod and company's doing, because they're actually looking at non-linearities over time, and they're not assuming steady state, which is really what you have to do if you're going to try to really nail those. So I appreciate what he's doing there. Again, I think it's is a first order approach to trying to figure out the contribution of exposures that you understand well, like water. I think we understand water pretty well. I think it's okay. Diet, if we want to figure out diet, we're going to have to invest a lot of money, because it's really hard, and it seems to be the big one. So,
All right, thank you.
Yep.
I have Jenny and then Jose.
Hi, I'm Jenny Quintana. Thank you for a really great talk. I have a kind of naive question because I don't really follow nutritional biomarkers very closely, but I was just kind of wondering if if you could comment or speculate about if you had you're looking at these compounds in biological fluids, are there other compounds that would indicate sources you could look in the same fluid? And I'm just thinking, for example, if we suspected tobacco smoke, we could look at cotinine, and is there anything like fish oils you could look at to indicate a fish source, but some kind of looking at it from within the sample itself?
Yeah. Hi. Yes, I think that's a really good idea. I don't know of anyone who's done that. I mean, one of the differences would be the sort of vast differences in time scale, right? I mean, PFAS have half-lives of years, a lot of them, and I don't know. Omega-3 fatty acids, I don't know what it is, but it can't be very long. So we'd have to think hard. And then you get into all those problems if you do one sample, how much do you believe one sample when you have short half-lives? But I think it's a good idea. And it actually, it reminds me of, like the work that was done that the biomonitoring people here mentioned, of looking at mercury as a marker for exposure to seafood. So I actually think that's a great idea. I don't really know what they would be. I'm not a nutritional epidemiologist, but it's a good idea. I hope someone looks at that some more.
Thank
Jose.
you.
Yeah. Hi, Tom. Thanks for the presentation. Good to see you. And just a quick question: how much should we be concerned about, or how much is known about cross-contamination of samples, so contamination of PFAS during the sample collection or storage, given the ubiquitous presence of a lot of these compounds? Do you know much about that? I know that there are a lot of certain recommendations. Some people are saying, well, avoid storing or the contact in glass containers because PFAS, so many of them can attach to glass very readily, or avoid, I don't know, low density polyethylene to store it because there could be some PFAS in there if you have not tested for that. Do you have any comment on that?
Well, I'm not an analytical chemist, so I let my chemistry friends worry about this, but I certainly look at the blanks. I mean, we always try to do blanks, and when we get high blanks, then you get really worried, right? So I think that my feeling, and maybe Oliver can chip in here, my feeling is that with the traditional PFASs, it's not that bad. But with combustion ion chromatography, you have to work really hard because there's fluorine everywhere, right? And so you have to actually work really hard, and that's one of the reasons they have high blanks, and so they need more sample in order to get detection levels and all that sort of stuff. So it's a big deal. Again, my impression for the traditional PFAS is that it's not as big a problem as say it was with PCBs, when people used to worry about, PCBs coming out of the fluorescent lights and all that kind of stuff. But anyway, our blanks always seem to come back pretty good for regular PFASs. So
I want to ask one of the questions that's in the Q&A function, and then Kathleen and Vina, and then I have another question in the Q&A. So from Simona Balan, great presentation, thank you. Do you have any recommendations for how to assess the impact on human exposure of phasing out PFAS from carpets? How would you tease that apart from other changes in PFAS use or exposure sources? Not unlike Jenny's question about, how can we mark the sources based on other co-exposures or speciation or what?
Yeah, no, carpet's a good one, and again, I'm really trying to figure out. You could imagine doing intervention studies where you replace carpet and you look at people over time or something like that, right? I'm very interested in trying to trace back the compounds we find in the indoor environment, like in the air or in dust, to their actual sources in the home. And that's actually hard. There's not been a lot of work done on that. And I suspect that carpets have something to do with it. And then there may be complicated things going on. It may not just be a release of PFAS from the carpet that's just attached to it, but it could be actual abrasion mechanisms and all sorts of things. And it's kind of not very well understood. But I actually think indoor exposure is probably going to turn out to be quite important for some groups of people. There's a famous example. There's a famous sort of case study that came out of Canada where there was a family that was using tons of Scotchgard or something. They're getting I don't quite maybe remember the details, but they were basically treating their furniture, their carpet all the time, and they had sky-high levels of the hexasulfonate, as I recall. So there are clearly going to be cases where this turns out to be true. And if we can change that product formulation, it ought to make a difference.
We just have a few minutes until our next talk. So I'm going to call on Kathleen, who's been waiting. And then I'm going to, just for the folks who've written something in Q&A, know that we'll hang on to that and bring that out in the next question section. So Kathleen and then Vina.
I could defer mine because it's related to what the anonymous attendee has asked, back to assessing sort of PFAS profiles. And I did want to say to Jenny and to the others, I really love the idea of working across panels to give indicators. Of course, I presented that on blood mercury, but we do have a phenols panel, so we could sort of course, that's a possibly different exposure window and shorter half-lives, but also there's cadmium for smoking and within metals. So it's going to be interesting to think about triangulating from different panels.
Vina.
Thank you for that presentation, Tom. It was really informative. I wondered, kind of thinking about reducing or preventing PFAS exposures, what do you think are some of the most important data gaps or questions if we're trying to think about policy approaches to reducing or preventing exposures?
Well, I tried to lay them out on that one slide. I mean, I really want to know what this unexplained organic fluorine is. I think that's actually one of the most important questions. I mean, I'm working on it. I know a couple other people are working on it, but I really want to know. Because if it turns out that it's other PFASs that we just don't have standards for, that's a really big deal. If it turns out it's mostly drugs, that's different. So they're very, very different implications of the answer to that question, or if it's pesticides or something. I think that the understanding diet is really important. If it really is one of the major routes of exposure, we need to know what's going on there. And I mean, in the meanwhile, we can do important things like getting PFAS out of food packaging. It seems like it's great that's being done, because that might actually turn out to make a big deal. We just don't know yet, and it's something we should be looking for, but I think that that's very important. Now, if it's bioaccumulation, then we're in big trouble, right? Because this stuff is everywhere out there in the world. So it'll mean that we have to wait for stuff to come down in the environment before we can fix that. And that's gonna take a while. So we should go after, I think we should go after the ones that are easy and that should respond quickly. You know?
Thank you for that, Tom.
Sure.
We will go on now to our next speaker. I want to introduce Kate Hoffman, who is an assistant research professor at the School of Environmental Sciences and Policy at the Nicholas School of Environment at Duke University. Kate holds a PhD from the Boston University School of Public Health. Her research focuses on the assessment of human exposure to PFAS, flame retardants, and other chemicals used in consumer products, as well as the health impacts of exposure to those chemicals. And she will discuss the relevance for human exposure of PFAS in indoor environments and drinking water.
Wonderful. Thank you so much. I am, in fact, one of those former students of Tom's. So let me just get my screen shared here real quickly. Okay, great. Can everybody see? I'll assume that yes, that you can see and hear me, but if you can't, somebody please let me know. So again, yeah, thanks everybody for the invitation to be here today. I am really excited to be joining you and to talk more about these indoor environmental exposures and also exposures through drinking water. Tom gave a really nice introduction to that, and he is a tough act to follow, but I'm going to try. So to give you kind of an idea of what I'm going to talk about, I'm going to first talk about the CDC and ATSDR multi-site study, which is really geared towards understanding PFAS exposures through drinking water and their potential impacts on human health. And I'll talk a little bit about the multi-site study specifically in California at UCI. And then I'll also talk a little bit about some work that I've been involved in looking at exposures to PFAS in the indoor environment. But before I do that, I just want to acknowledge that I have no financial disclosures or relevant conflicts of interest with the materials included in this presentation. I will be discussing the CDC and ATSDR multi-site study and the work of my colleagues related to that study. The views expressed are completely my own. I'm not currently involved in any CDC and ATSDR multi-site study projects. Okay. So as Tom mentioned, we do think that drinking water is a main source of exposure to PFAS. And the reason for that is just mainly that PFAS are highly soluble. They're detected in many drinking water supplies across the country. And much of what we know about that exposure comes from the C8 Health Project study, which is based in Parkersburg, West Virginia, and the surrounding communities. And that study looked at exposure primarily to PFOA and PFAS, but there's sort of this desire to know more about other PFAS compounds. And that was a really large study. It's kind of limited in the scope of compounds that we know things about from that work. And so to that end, the CDC and ATSDR started this multi-site study project with the goal of looking at sites kind of across the United States that would have different PFAS exposure profiles and comparing exposure at those sites in its relation to different health outcomes. The health parameters of interest include things like immune response, lipid metabolism, kidney function, thyroid disease, liver disease, glycemic parameters, and diabetes. And these are all kind of non-cancer health endpoints. And I'll just say that I think there is some interest in also trying to understand cancer health endpoints, also reproductive health endpoints, but keeping in mind that even though the multi-site study will be large, enrolling about 10,000 participants, it still will be hard to study some of those rare health outcomes or those that take a long time to develop in this population. So that's sort of one kind of limitation. I think that's data they hope they'll get, but we'll see how that develops. So it is a 5-year study, and the sites in the multi-site study were announced in late 2019, which, as all of you can imagine, was a difficult time to start a large nationwide kind of epidemiologic study. So there's some challenges with that I'll talk about in a few minutes. But I do think it's important to note that there are sort of 7 multi-site study sites, but the study framework really comes from the PEACE study, which is in Fort Smith, New Hampshire. And that study is sort of based on the PEACE International Trade Sport, which had PFOA contamination of drinking water there. And so they started this study there, which outlines sort of the protocol for the other multi-site study sites. That study has enrolled about 700 people. They started enrolling about the same time as the other multi-site studies were announced. So they've made good progress over the last couple of years. And I'll just note here that there's a link to the multi-site study website on the bottom of my slide. So if you're interested in knowing more about the sites, you can look there. So there are sites of the multi-site study all across the United States. The one thing that all of these sites have in common is a documented history of PFAS contamination of their drinking water. But the source of that contamination is different across sites. So some of them have drinking water contamination from past military or AFFF firefighting foam applications near those sites. Others are related to industrial activities. And really importantly for your discussion today, in Orange County, California, you have a multi-site study site right there in your home state. And so at each one of these sites, they hope to recruit 1,000 adults and 300 children. So all told, if you include PEACE in that, you'll get about 10,000 people enrolled in the study. As I mentioned, this did start at the end of 2019, which was a hard time to kind of get a bunch of in-person visits and study enrollments done. So these sites, I looked this week at their websites to kind of see where everybody was in terms of enrollment. So some of these sites are just starting to enroll participants in the study, and others are sort of 10 to 15% enrolled, I would say. So it's still kind of in the beginning stages of enrollment in the study. To ensure that the data can be shared across sites, they all will use a common core protocol, as well as a common IRB and a sort of centralized data management team. So the same questions and same tools are being used at every site. Each site is going to perform groundwater modeling and exposure reconstruction for all their participants. And this is actually one area that they've made progress in over the last couple of years, where they're sort of waiting to do those in-person study visits. A lot of sites have made progress in this area. And really importantly, they have site-specific community engagement plans at each one of these study sites. And there's some additional research activities, which I won't get into. But if you're interested, that multi-site study website does include a link to each of the individual study sites websites. You can see what's going on at each individual site that may be specific to their exposure. And just one thing that I wanted to sort of highlight is, you know, while the C8 health study had kind of a lot of people with one sort of high PFOA, a little bit of PFAS kind of exposure profile, or at least we think that's what it had. These sites all have kind of different PFAS exposure fingerprints. So there's some variability in exposure across sites. I won't go into the details here too much just to save time about what exactly has been measured. There's a lot of information on questionnaires, including residential history and water consumption information. I'll just say that the water consumption information is more detailed than what was collected in the C8 health study. There's information, a bunch of health information that's being collected that's also being validated with medical records and also medication lists. And then really importantly for the study, there are fasting blood and urine samples that are shipped to the CDC for analysis of PFAS, as well as biomarkers for some of these health endpoints. So those are all being analyzed in the same lab. If you're interested in more detail about what exactly is being included in that protocol, you can click on the link there and go and see all of the detailed measurements and how they're collecting those in the study. It is sort of a limited number of PFAS under consideration still. Okay, so now I'll say a little bit about the PFAS health study at UCI. So this is headed up by Dr. Scott Bartell and Dr. Russ Detweiler. Probably most of you are much more familiar with California geography than I am, but this study is based in Orange County, which is in Southern California, and it's primarily in the Orange County Water District, which is outlined here in this blue color. Over 500,000 people are served by water systems within 10 miles of the University of California Irvine Medical Center. And in that UCMR3, which was conducted in 2013 and 2015, all of these water systems had at least one exceedance of that 70 parts per trillion for PFAS and PFOA. So there is a documented history of PFAS contamination of the drinking water there. And how this site compares to other multi-site studies. In general, it's more diverse than other sites. About 50% of children in this area speak a language other than English at home. And then one thing I would just point out is that the source of exposure is a little bit different, at least the presumed source of PFAS contamination in drinking water in this area is a little bit different than at some of the other sites. So what else makes this a good site? And one thing about that is that in California, you have a lot of information about drinking water that's super valuable for a study like this. So this is a picture of it's a cross section of Orange County's groundwater basin. And so because you have a growing population and years of recurrent drought, there's really good management by local water utilities of source water and water consumption. So local water utilities use seasonally varying combinations of groundwater and surface water, as well as imported water to meet that demand. And there's a lot of really good data on that. And the groundwater supply is really carefully managed to that end. One important thing that I'll just point out here is that the source of the PFAS in this drinking water supply is thought to be through wastewater treatment plants, so the reuse of that water. And I think that's an important difference between some of these other communities where we think that, the main source of PFAS in their drinking water is through AFFF or other military activities. Okay. And so one thing about PFAS in the Orange County Water District, and I think a lot of other water districts, particularly in California, is that, once PFAS were detected in that 2013-2015 UCMR report, those wells with the highest concentrations were taken offline. And so since that time, there's been sort of additional well monitoring and sort of changes in which wells were used at different times, including 38 wells being taken offline in July of 2020 in response to new stricter state health guidelines to sort of reduce the levels of PFAS in finished drinking water that people were receiving. And I'll also just note that at great cost, Orange County is also currently testing advanced treatment systems for their drinking water to remove PFAS. So I think if you kind of take this all together and take this picture all together, it's very likely that exposure to PFAS in Orange County has probably decreased substantially since 2013 and 2015. And that's something that the study will kind of work through and help identify that. And I think this is probably a story that's going to be true in a lot of other communities as well, particularly with the new EPA roadmap. So as we see these impacted communities with decreasing PFAS in their drinking water, it's possible that they'll become more and more like sort of general population exposures, and that other sources of exposure will become more significant contributors to overall exposure. And one source of exposure that I'm very interested in is exposure in the indoor environment. And so why am I interested in exposure in the indoor environment? And the reason for that is sort of twofold. One, the average American spends like 90% of their time or more indoors, maybe even more than that over the last couple of years. And so if you don't have a whole lot of PFAS in your drinking water, indoor exposures may be more important in your overall level of exposure. But we also know that PFAS are used in a bunch of products in our home, right? Like they may be used in textiles or carpets or furniture products, maybe to a lesser extent in California, but because these are sort of slow replaceable products in our homes, we would expect them to kind of stick around for a period of time. They may also be used in other applications like paints or personal care products or clothing. So we're going to expect to detect these in our homes for a long period of time. And because they're used in so many products, we're going to expect that they're going to be found commonly in indoor dust and indoor air, presenting a possible source of human exposure. And Tom actually talked about this in his presentation as well. Just highlighting that this figure shows past research on different environmental media and their importance as pathways of exposure to PFAS. And you can see here that between dust and diet, those have been considered in about 70% of past studies. But only 11% of studies have considered indoor exposures through indoor air or dust and what exposure through those pathways may look like. So while these pathways may be really important sources of exposure for the general population, we know much less about them. And so I'm going to talk about sort of one study where we've been looking at indoor exposure. There are certainly other groups that have been doing this, and I'll try to highlight some examples from those groups as we go through. For the sake of time, I'm going to talk about this one study, even though it has some limitations for some of the applications we'll talk about. But I do just want to mention briefly that this study is a collaboration with Heather Stapleton and Tom Webster, as well as their students and postdocs that we've been working on for several years. I want to acknowledge that effort. We call this study the Toddlers Exposure to Semi-Volatile Organic Compounds in Indoor Environment Study, or TESI. And we've been working on this since 2014, but we visited kids' homes between 2014 and 2016. We did 200 home visits in central North Carolina during that time. We had kids in the study provide a blood sample during home visits, and they also provided a bunch of different samples, which you can see here. The numbers on these different samples are a little bit different. And that's, just due to different challenges with getting different samples from kids. I'll say a little bit more about each sample type when I talk more about them. We measured PFAS and indoor dust and air. And when I say PFAS here, I'm really kind of like Tom, using a pretty narrow definition. So I'm talking about those legacy compounds and also to some extent, some of the precursor compounds like the FTOs. Or the PFAS compounds, but I'm using that as a pretty narrow definition here to just refer to the compounds that we measured. The serum samples we sent to the CDC, and they were analyzed for that kind of standard NHANES type panel. And one really important thing to note about this cohort is it is central North Carolina. And if any of you know about our drinking water here in North Carolina, does have some PFAS and water concerns of our own. But this is primarily our participants came from Durham, North Carolina, and used municipal water here, which has generally fairly low levels of PFAS contamination. There's a little bit of PFOA detected, but in general, the levels are quite low. We've sampled it several times, and that's been a pretty consistent finding over the last few years. Okay. So, one thing I'll note is that we call this a toddler study, but by the time we made it out to do these home visits, the kids were a little bit older. As you can see, this is one of our participants here. The participants were about 4.5 years old by the time we visited them in the study. They were about 40% non-Hispanic white, 40% non-Hispanic Black, and about 20% Hispanic. And about half the moms had graduated college at the time we visited them. And I'll just point out here, this compares concentrations of the 4 most commonly detected PFAS compounds in the participant's serum with those in NHANES. And this is the data from NHANES 2013 to 2014 for kids 3 to 6. So it's a similar time frame, similar age group. And you can see the most important thing to note here is that exposure looks pretty similar to kids in NHANES. The levels are about the same, and both PFAS and PFOA were higher among these particular compounds. And all of these 4 were detected really frequently. Okay, so now this is some work that was done by Sam Hall, who is a doctoral student currently here at Duke. And Sam recently published this work, and there's a link to that publication here as well. So we went out into each of these homes and we collected a vacuum cleaner dust sample in the main living area, and there's a photo of the team doing that here. And what you can see is that we detected a number of different PFAS and dust samples from these homes. The precursor compounds, in particular the FTOs, which are shown here in red, were detected at higher concentrations than the legacy PFAS, which are shown here in blue. FTOs and DIPAPs were both detected at medians above 100 nanograms per gram in dust or higher. And I just want to show that slightly differently because I think it's kind of hard with a log scale here. You can get a little bit lost in that data. But if you look on and this is not like a non-targeted analysis or anything like that, if you look at just the percentage of the targeted analytes that we measured that were each of these particular compounds, the 6,2 and the 8,2 FTO made up greater than 90% of the total mass of the targeted PFAS that we measured in dust. So these two compounds contributed quite a lot to the total PFAS burden of dust that we measured. Okay, and I'll just kind of mention some good news in this story. Sam went out and she collected the medians from 6 other studies who had data for PFOA, PFAS, and PFHXS in US house dust samples and plotted those over time, and that's what's shown here. You can see that for those compounds, it really seems like there's some real significant increases or decreases over time in the medians in those house dust samples, particularly just noting that this is plotted on a log scale. So it seems like it's a really substantial decrease from over the last maybe 20 years. One kind of important caveat about that, and one thing to think about, is that while these 3 compounds are decreasing, we don't have good data on some of the replacement compounds. So it's possible there are concurrent increases in other PFAS compounds in house dust. And similarly, we don't have a lot of information on some of the precursor compounds over time. So some good news here, but potentially some bad news too if we had more data. Have to look at that. And now I'll talk just a little bit about the air data from those same homes. This work was led by Jessica Craig, who's a former doctoral student of Tom's, but she defended recently. We deployed these air samplers as a passive air sampler, one of them shown here, and each one had a sorbent impregnated polyurethane foam disc. So there's a little foam piece on here that collected PFAS in the home. These were deployed in participants' homes for about 3 weeks. And kind of the main thing to note here is that, like the dust, we detected these more volatile precursor compounds really frequently in participants' homes. Again, the FTOs were the most frequently detected. We also detected these PFAS compounds, ethylphoce and methylphoce, in most of the homes that we sampled. Okay, and so now the big question, right? So were any of these things that we measured in air or dust related to children's serum concentrations? And that's something that Jessica spent a lot of time looking at in her dissertation work. And so one thing I'll just point out is that, you know, we didn't have huge numbers of overlap between all of these sample types, as I mentioned, because we had some fewer blood samples or some fewer air samples. But even with that limited sample size, she saw really strong associations between some of these precursor compounds in air and PFAS in children's serum samples. So just like in the paper that Tom showed with the woman in Vancouver, we saw this association between this PFAS compound, methylphoce, in air and PFAS in serum, which kind of makes sense on that potential breakdown pathway. I know this is 3 dots here, but this is just the linear and branch PFAS as well as the sum total of both of those. So again, this is consistent with the results that Tom showed from that Vancouver cohort as well. Similar associations have also been reported for the FTOs. We didn't see that as strongly here with air, but that was certainly reported in the previous cohort Tom mentioned, but also in a cohort of office workers in Boston that Tom was involved in as well. Importantly, there were no strong associations with dust in this cohort. So it really does look like that kind of airborne pathway may be more important in terms of tracking exposure. And then one thing I'll talk about, because I just can't hold myself back from talking about wristbands at any opportunity. I know some of you may work with silicone wristbands as well. We use these as kind of an alternative sampling tool to address some of the limitations with collecting samples in the home environment. As you can imagine, if you collect a sample in someone's home, that's really helpful, but it doesn't capture every indoor environment that they visit, because you may go to your office or go to school or leave your home to go some other places. So we asked kids to wear these wristbands, and the idea behind their use is that they kind of sorb compounds from your ambient environment while they're being worn. So we asked kids to wear those for 7 days. And we saw really similar patterns of association between the compounds detected on wristbands and PFAS in serum, for example. So we saw kind of similar patterns. I won't go into a lot of detail just for the sake of time, But this suggests that these wristbands may be a useful tool in monitoring indoor environmental exposures. Okay, now I'm going to talk about just some challenges in investigating and regulating indoor PFAS exposure. And I think Tom touched on some of these as well. One is just that sampling the indoor environment is much less standardized than biomonitoring approaches. So we can agree on how to collect a blood sample, I think. But when it comes to how to collect a vacuum cleaner sample, it's like all bets are off. You know, do you collect someone's vacuum cleaner dust bag, or do you vacuum it yourself? Do you vacuum the living room? Do you vacuum the bedroom? Where do you vacuum? How big a spot do you vacuum? And so there's a lot of challenges with that. And I certainly don't mean to say that the biomonitoring piece of that is easy, but there's sort of these different batch of challenges that we still have to kind of come together as a group and sort of resolve exactly how we're going to do that. In addition to that, prior studies investigating indoor exposures have been relatively small to date, and they're primarily based on convenience samples, so people that we can get to come in and address that. It's also a really wide range of physiochemical properties, which I'm sure you're all well aware of, that make this challenging to study. This existence of precursor and polymer compounds, which Tom mentioned, is also challenging. We don't know exactly, you know, we've got to see what's breaking down to what and know what's actually being used. Those are certainly real challenges. There are a wide range of source products. I know this came up in the questions previously, thinking about things like, well, if you reduce carpet, how much will you see that reduction in exposure? And I think that's an excellent point. And then a lot of the biomonitoring data that we have are primarily from impacted communities, sort of on the national level. And so that's certainly a challenge with thinking about these indoor exposures or exposures that may not contribute as much to total exposure. So just to summarize sort of the main points from my talk today, the multi-site study will provide important information on PFAS exposure in communities with varying levels of contamination across the United States, and sort of this varying fingerprint of PFAS exposure. As Tom said, and I think, you know, I hope this will show as well, when water PFAS concentrations are known, pharmacokinetic modeling can provide pretty good information about the contribution of that exposure to overall PFAS exposure. That's true for some compounds, but not all. You know, there are some that we don't have good pharmacokinetic assumptions for yet, and so that's kind of a challenge. Exposures in Orange County may become more like general population exposures over time, and other sources may become more important in terms of how they contribute to that overall cumulative exposure. And at the same time, while investigations of indoor exposure pathways remain limited, extensions of the multi-site study could be really helpful in addressing those indoor exposure pathways or just other pathways outside of drinking water in general. So I want to just briefly acknowledge folks who have been involved in this work, but in particular, I want to acknowledge Heather Stapleton and Tom Webster, who have both been involved in the TESI study, as well as many of the other studies that I mentioned in this project, and also the UCI PFAS health study team, including Scott Bartel, Russ Detweiler, and Veronica Vieira. And with that, I know I'm standing between you and the break, but I'm happy to take any questions.
Thank you so much, Heather. You just said Heather Stapleton, Kate, who's been presenting. My apologies. We have a couple of questions that are sort of teed up in the chat, and I think these will overlap with your work, and I'd also invite Tom to chime in if that's helpful. One is there are several sort of in quotations epidemiological studies showing much higher levels of some PFAS in infant blood relative to that of mothers, for example, PFOA. Could you please comment on early life exposures and its importance in PFAS risk management? That wasn't something that was directly in your presentation or even necessarily in Tom's, but I think you folks are well aware.
Sure, so I can chime in on that a little bit in terms of, so we actually, in the study that I talked about, had measurements of maternal serum as well from this cohort, because it's a spinoff of a pregnancy study. And in that study, you know, even these kids were like 4.5 years old, and we still found associations with maternal serum for some of them. And so, you know, clearly it's something that's still important in terms of predicting their overall exposure. So certainly it's something to think about. I don't know if, I'm happy to have Tom weigh in on is that as well. I don't know.
I'm sure that's the open question about, is that from prenatal exposure or because of shared environment?
Yeah, I mean, certainly it's hard to know. I mean, I think that's, you know, and I don't think, you know, this cohort that we have, we're obviously, it's not an ideal source to look at that. Just because we have some people who moved, some people who didn't. So I don't know. But yeah, I mean, I guess it could be both.
I think it's clearly both. And when we know PFAS crosses the placenta, we know it's in breast milk. Little kids are down on the floor sticking things in their mouth. So, I think it's going to, and they're living in the same environment. So I think it's going to be very hard to disentangle them, actually, I imagine.
The next question is one that was Kathleen was wanting to echo. From an epi perspective, how do you try to examine exposure sources of one PFAS congener to another, given that they're so correlated?
Yeah, and it's really tough. And even in the, even in our data, we see some things at times that don't necessarily make perfect sense, right? Because we see some of these associations with compounds that are like even in those precursor pathways. Sometimes those breakdown pathways are not compounds that we know break down into each other. And I think part of that is because you get this pattern of people who are using similar products or people who are having similar types of things in their home. So I think you're going to have that problem of some of those exposures tracking together. And I think that's going to be true of a lot of things. So we actually see correlations between a lot of these compounds in dust and serum that don't necessarily follow a pattern you would think. Like some of these PFAS compounds are actually a little bit correlated with things like phthalates. Now, why is that? It's not because of the common use, I don't think, but it's because you have more consumption of goods in your home. So I think there will be some things like that. And it is hard to tease that apart and identify exactly what products that's coming from. So I don't know if Tom, you want to weigh in.
Yeah, no, I mean, I think this is one of the challenges of doing the epidemiologic approach is that you actually have to think like an epidemiologist. You have to think about confounding, right? I mean, the air and diet pathways are going to be to some degree, air and inhalation and dust pathways are going to be partly correlated with each other. And then things like socioeconomic position can influence purchasing of what's in your home and also diet, right? So all those things you have to actually think about that with that. But epidemiologists, we sort of know how to do that. So it's possible.
There's a brief question here about with respect to Kate's note about PFAS being removed from municipal water. And the question is it treated in any way or is it just treated as waste? That is what happens with PFAS removed from the municipal water.
I think that's going to depend totally on where you are and how it's being managed. So I think one strategy that's being used in California is when it's found in a well, they stop using that particular well. So we're not pulling it from that source at the time. So we're going to other source uses. And then I think there are varying degrees of success with using other products to remove PFAS from water. We did a study a couple of years ago looking at the like how successful different home-based filtration methods of removing PFAS from drinking water were. And it's pretty variable, honestly. And so, obviously if you're just pulling that out with your home Brita, you're just throwing that filter away or recycling that filter after you're using it. So, I think that's going to be super variable depending on what water district you're in, how they're actually managing that. If it's just a purely, we're just going to dilute it with some water that we think doesn't have PFAS, or what kind of treatment that they're using. Is it an activated carbon system or what exactly is being done?
Two more questions. If you don't mind continuing the rapid fire from Aaron Maruzo. Nice presentation, Kate. I have a couple of questions. One, were U.S. territories considered when selecting impacted communities for the multi-site study? And more generally, can you talk about how sites were selected? The second question is, what are the detection limits for dust and air samplers? And the third is, have the concentration data been disaggregated by race and ethnicity? And I can repeat those questions for you if you need them as we go along.
We'll start at the beginning, and I'll say that I didn't participate in the review panel or anything like that for the multi-site study, so I don't know exactly how sites were selected for that. The criteria were certainly a documented prior PFAS exposure. I am certain that those were limited to US sites. I don't know what territories would have been included in that. So the first one is an easy, I don't exactly know. Let's see, you asked about detection limits. Was that the next one?
Detection limits for dust and air samplers.
Okay, so they're going to be variable across the compounds that I mentioned, and they're certainly published in the papers that are linked with those. So I don't have them offhand. They're not particularly unusual. They're comparable with sort of other studies in the literature on that. I'm happy to follow up on that, or you can look to those published papers on them.
And the third is, have the concentration data been disaggregated by race or ethnicity?
Okay, so let's see. In this cohort in general, so I'm assuming you're asking if there are sort of differences by race and ethnicity in terms of these indoor concentrations.
It's not my question, so I can't answer, but I assume so.
No, okay.
I would interpret
Okay.
it. So
yeah, so it's interesting. We saw some so we have looked at that in terms of biomarkers in this cohort. We did not look at it in terms of the indoor exposures to the same extent. And part of the reason that we didn't do that is because we don't have as many samples. We had 50 air samples. And so, when we start breaking that up by group, we're just a little bit limited in our ability to do that. But I'll talk about the biomarkers for a second with that. So we did see higher levels of those biomarkers in general, PFAS biomarkers in our non-Hispanic white participants compared to the non-Hispanic Black and Hispanic participants in this cohort. And that's sort of an opposite trend for other semi-volatile compounds that we measured in this population.
okay, I have one more here in the Q&A, and then we'll have cleared our backlog.
Okay.
From Summer Solstice Thomas at Silent Spring Institute. Kate, brilliant presentation. Thank you so much. I know you talked about the difficulty of standardizing collection of indoor dust samples, like the methods of vacuum collection. But from your expert perspective, is there a best practice method?
Gosh. Well, so I think it's completely out on this right now. So I think, one thing that I'm really interested in right now is there variability, sorry, in these compounds within the home? I think that's something we actually don't know. And that's a key thing to determine in thinking about this question. So we sampled the main area that the child played in the home while they were awake. Because we were interested in a wide range of compounds, and we were thinking about this idea of hand-to-mouth exposure. Knowing that air is particularly important for these compounds, I'm not sure that's necessarily the right environment to sample. We might have wanted a sample in another location too. But, I think this is a really important question. Do you see differences throughout the home? I would imagine you're going to see differences in rooms with carpet versus rooms with no carpet versus, how does that change throughout the house? So I'm giving you a really unsatisfactory answer there and saying that I don't know, but I think this would be a really important area of research to say, do these compounds vary throughout the home? What areas are they really high in? Does ventilation matter? And some of those kind of questions.
Kate, you're going to be here for the afternoon discussion session, right? Okay. I see there's a hand raised in the participants, and we haven't gotten to panel questions, but since we're going to discussion after the break, perhaps we could just touch base and get any remaining questions after the break. Rather than leaving 30 seconds for the last question here, I would suggest instead that we break and resume in 15 minutes. We will begin promptly again at 3 o'clock. and pick up where we left off. Thank you so much. Okay, I have that it's 3 o'clock and we'll restart the meeting, and this sort of launches our afternoon discussion session. I want to use the chair's prerogative to spend the last few minutes just making sure we've answered all the questions from the presentations before the break. We have one participant with a hand raised, and I would invite you to unmute and ask your question. It looks to me like you're still muted. I don't know if that's on our end or yours.
We have invited the person, the attendee, to speak. They need to unmute themselves.
We can return to that person if they're not back from break yet. Maybe we should go to Ulrika, who has a question.
Thanks. Yeah, thank you, Kate, for that really interesting presentation. I had a question, if you could maybe tell us a little bit more about whether your study provided, any clues as to what some of the main sources of the airborne PFAS precursors were that you found.
Yeah, it's tough. I mean, I don't think we know, and I honestly don't know that we have the questionnaire data to be able to answer that. Although I do think there is some potential, and I noticed there was a question about this in the Q&A before the break about thinking about carpets. And I do think there's some potential to do some of that with questionnaire data. But this study was really geared towards looking at all kind of semi-volatiles in general. And so I don't know that we going into it necessarily had all the right survey questions at the time. It was also 2014 when we started. So I think if we had some of that data going back, it would have been really helpful. One kind of interesting thing that we did see was some sort of seasonal variability in some of that. It's a small sample. And so when you start to parse that out over seasons, there's a little bit of difficulty in looking at that. I do think there's some differences in ventilation that could be really important to think about. So that's one that's certainly interesting. It doesn't get you to source at all, but I think it's an interesting consideration for moving forward.
Thank you. Were the concentrations lower, just if I could follow up, in the seasons when you would expect people would have more ventilation? I mean, open windows, or I don't know what types of what seasons had the lower levels, I guess is what I'm asking.
Yeah, in general, I think they tended to be lower in springtime, although I would have to confirm that for sure. I believe it was either spring or fall. But I think part of the reason for that is, we're North Carolina, we're hot and humid. We have central air conditioning everywhere. And so, I think the only time of year when we have our windows open, maybe it was actually fall, but it was a season when we would expect more potential window open kind of weather.
Mina, go ahead.
Thank you. Thank you so much for that presentation, Kate. I've been a fan of your flame retardants work for a long time, so it's really nice to see you. I have two questions. One is, that for other contaminants that we find in indoor air and dust, sometimes levels can reflect kind of infiltration or migration from the outdoors to the indoors, like pesticides being trapped in or brought in, or air pollutants infiltrating from the outdoors to the indoors. So I wondered if there's any indication that those types of patterns might be contributing to indoor levels of PFAS. And my other question was, were there any sort of associations between levels of PFAS between air and dust?
Yeah, so I mean, so one thing I want to be really careful of is to not make a overly broad statement about all PFAS, just because it is a really broad class, and I touched on this at the end, but just to say that, we're looking at a huge range of properties. And so for some, we're going to see different things. So in general, I would say for the compounds I mentioned, I think the concentrations in indoor air and dust were higher than outdoor. So I think that the idea of that coming from outdoor is probably not very likely. So I would say that probably is true for most. Could there be some? Potentially. And let's see, can you remind me the second part of your question? I lost that one.
Did you see any kind of correlations between levels of PFAS between the air and dust?
Yeah, Tom, you can chime in too if you remind me of this, because I know Jess did that as part of a dissertation. I think in this population, they weren't super strongly correlated, but I will say in some previous work, particularly Tom's office study, I know, and I think probably Colleen's work has previously shown pretty good correlations between indoor air and dust. I think in this population, they were a little lower than what's been reported previously.
Yeah, I haven't looked at these data in a while, but that's what I remember as well. One would expect there to be some association just from partitioning theory. I do know that there's some weird stuff with PFAS. I mean, I looked at some of this data before where the sort of air to dust ratios are not what you would predict based on octanol air partition coefficients. And I think part of it is that we don't actually know some of the PChem properties very well, because PFAS are weird, right? But the other is, I think some of the stuff that we're measuring dust is actually maybe bound to the carpet or whatever it is, and so it's not actually fully, in equilibrium with the air. So there's a lot to be understood here of exactly where it's coming from and how it's getting into air and all that sort of stuff that we just, there's been very little work done on it.
Thank you for that, Jenny.
I thank you for a really interesting talk. I was just thinking what a natural experiment might be happening now with a lot of, especially workplaces, going to increased outside air because of COVID. So really increasing the outside air ventilation. And so it might be an interesting study to see the effect of this, increased outside air ventilation on people's levels. It's kind of a really broad scale natural experiment.
Yeah, I mean, I think, boy, one thing about the last 2 years is it's been a really interesting, it has definitely spurred so many ideas about thinking about indoor exposure for me, because, it's this one time where suddenly everyone was spending all of their time at home, right? And so you had one environment that you were spending all your period of time in. And so I think that was a really unique period of time. And now certainly we have this idea where we have more ventilation or different ventilation, and particularly in schools. I know my kids' schools right now are like open all the time. And how that might impact exposure is a really interesting question. I don't know if anyone's doing anything on that. I'm not aware of anybody, but I think that's really interesting.
One thought that occurs to me kind of in concert with that is just the, we've seen so many disparities or inequities kind of widen in the pandemic. And of course, that status of are you at home or are you at work depends a lot on your occupation. When there's a big chunk of people who aren't able to stay home. And I don't know of anybody specifically looking at this, but I would be intrigued. It feels like an opportunity to really understand some of the impacts of particular workplaces when there are places that people have had to go where everyone else who isn't a frontline worker of some sort for a time didn't go into their workplaces.
Mm-hmm.
I want to check in again. I see June Supark with a hand raised. I want to check in and see if Kimie Tucci is back and invite you to ask your question. If you're back, you are permitted to talk and just need to unmute your at your end if you want to ask a question.
It was a great presentation again. I'm just curious because I see dominant compound, PFAS compound detected in your dust samples were or even numbered F-TOR 6282. But I remembered a few years ago one publication survey municipal landfill leachate. They did measure dominant congener, some odd numbered the F-TOR. Have you looked into the like 5373 F-TOR in your sample, dust samples?
Yeah, no, we didn't do that here. And in fact, in these particular dust samples, we only measured the 6.2 and the 8.2. We also measured some firehouse dust samples at the same time. In those, we measured 10.2 as well. But these were just the 6.2 and the 8.2. So like I said, it's a very limited, I say we measured PFAS in these, it's still like a tip of the iceberg list, right? Like it's still really small.
Yeah, I totally understand. Yeah, thank you.
Thank you. I want to move on to our discussion portion and just make one last call to see if the participant, Kimie Tucci, wants to ask a question. And if not, request that you lower your hand so we know that that moment has passed. Okay, I think we will go on and start our discussion now, which I just want to introduce for a moment with some questions that the biomonitoring program has posed to us. So the overarching question for this discussion is how Biomonitoring California can support PFAS exposure reduction efforts. Basically, how could data from the program be used in that way? We can think about what we heard so far today to help inform our advice to the program on the next steps, both in terms of future study design and the opportunities there are for data analysis that Kathleen highlighted. So I want to show some slides that the program has put together to just frame this conversation. I'm working on it. Get the right screen shared. I think that should do it. So each of these has a question on it, just meant to focus us on guiding the program. So referring to the opportunities for further analyses of the existing data sets on PFASs that were highlighted by Kathleen Atfield this morning. The program's questions are, number one, which are the most promising for illuminating PFAS trends in California? And what type of analyses would you recommend to further understand the sources of the racial disparities that were reported, that were observed in those data sets? So what analyses would you prioritize for looking at PFAS trends in the state? And how should we better understand what's driving the racial disparities that were observed? First. The second is when looking at the PFAS data for pregnant women from the MAMAS project, which is based on the blood spots. This is a reminder, what potential limitations and confounders should we be concerned with? And specifically, how should these limitations and confounders inform the design of future sample selection from the GDSP, which is the Genetic Disease Screening Program Biobank that is the repository of these blood spots. So thinking about what are the limitations and confounders of that as a sample source and how to keep that in consideration. With regard to identifying key PFAS exposure sources in biomonitoring studies that are intended to inform exposure reduction efforts, the questions here are, what advice do you have on designing questionnaires that are meant to assess PFAS exposure? What limitations of questionnaires are of concern for evaluating PFAS exposures? And we saw several multiple examples of data provided by questionnaires in the earlier presentations today. So anything that arose from that, and what other approaches would you suggest to help evaluate PFAS exposure sources in the studies, that is, other than questionnaires, I assume is the point of this question. And for this, I just want to flag, and we can return to this in our conversation, the notion that's come up a couple times about looking for co-exposures that might illuminate sources of PFAS exposure. We raised that in the morning around the question of fish exposure, that is fish consumption and its association with PFAS exposure. And are there ways like looking at mercury concentrations to evaluate whether that's happening in fish at higher levels of the food web? And then also this afternoon question about looking more broadly at other kind of co-exposures that might point toward individual sources of PFAS. And then the final question is just a broad one. Any other input on next steps for Biomonitoring California that would support PFAS exposure reduction efforts? So I think I'm going to stop sharing my screen because otherwise we have to dedicate it to one question or another, and I also can't see participants. But let me know if you want me to reiterate any of those questions, and we can revisit them if we run out of things to say to make sure that we've responded to all of the program's questions. I also want to just mention that in this discussion session, I will call for public comment at some point, but let's start off with folks who have their hands raised. I have Kathleen and then Narissa.
Narissa, maybe you could just go ahead.
Yeah, I'll just, I just wanted to chime in. One correction is that the samples for the mamas are actually a prenatal serum sample taken during the second trimester of pregnancy, not a newborn blood spot. And I think the timing of when that is taken, one of our questions is related to how you would design or analyze mama's data related to things like blood volume and how pregnancy might impact that and your subsequent PFAS levels.
Thank you so much, Narissa. Yes, I messed that up. Thank you for clarifying. Carl Krainer.
Can you hear me? Yeah.
Yes.
You raised, gosh, I'm echoing. You raised a question about minority communities. And I'm wondering, have you ruled out where they live? I mean, the PFOAs may or may not be part of living near an industrial area or something like that, but they get a lot of contamination for, things that they live next to, their houses, their sources of air pollution. Some studies have been done, things like that. You could rule them out or maybe rule them in. Just a question.
Kathleen might want to say something about this, but or Narissa, but as I remember from the morning's presentation, it was Asian participants had the highest exposures, followed by white, and then Black, Hispanic, and then Black. Is that right? Do you all mind reading that?
Yeah, that's correct. And I did find it interesting that in the North Carolina studies, they were also saying whites greater than Hispanics. So the same pattern is happening elsewhere in the country for that. As far as Carl's comment, it is interesting to try and think about which locations might be of immediate concern, and I might punt that over to Carl Palmer a little bit. But we definitely don't have any large manufacturers of PFAS in California, for one. And so, yeah, maybe the chrome plating or well, then you're, as Kate Hoffman was talking about, then you're looking at some of the more dispersed source pollutants, which are sort of somewhere in between a very local and a very diffuse pollutant source, such as the wastewater treatment plants feeding into the Santa Ana River.
I just thought it was worth mentioning because often these communities live in buildings or areas that have been pretty contaminated.
Right, and that's certainly a kind of analysis we could do, similar to what we've done with 1-nitropyrene, where we could do some GIS work if we knew what sources we were looking at and do kind of distance to traffic or distance to a facility in this case. We do have addresses for our non-MAMA's data, and so yeah, that is something we could look at. Or I mean, it's a question of if that is our priority. I think it's one of the dominant exposure sources.
Tom McComb.
Hi, thank you. So this is, I'm kind of struggling with some of the conversations we had earlier about how hard it is to really tease out, what we're seeing, because there are competing pathways and similar substances with the same biomarkers. So it's kind of a chicken and egg, because I think, the only way, we're thinking about how to improve biomonitoring to understand how to reduce exposures. And in a way, the only way we're going to understand that is to reduce exposures and see what happens, right? Which, I don't know how you do that. And so maybe that's what we need to think about. Are there ways to look at market trends or reductions, things that should reduce exposures, and see if they're actually happening? It's sort of like, in an ideal world, if we could do everything we wanted, we would do this differential analysis. We would remove one product from the market totally, and then put it back in the market, right? A case crossover kind of study. And we can't really do that, but maybe it's possible to think about ways to watch the factors like consumption patterns, consumer products, or even some very targeted questionnaires to see where there might be reductions in exposure and see how that plays out in the biomonitoring data. And then we can go back and say, okay, we kind of confirmed that hypothesis to some extent. So that might be somewhere where we want to put resources. But again, it's very but I struggle with just absolutely at this point saying, oh, given the uncertainties we heard about today, we're supposed to say this is the best thing to do to understand how to reduce exposures, where that's going to be very hard to do until we have a better understanding of these complicated relationships.
Thank you, Tom. If it's okay, I'll insert my own comment, and then Ulrika, I'll call on you next. One thing that's been on my mind is something that comes up a lot is sort of treating PFAS as a group and talking about it as PFAS in general, all PFAS, versus the different chemicals that are used in different applications and that seem to change over time. And of course, with the absence of, required reporting, we don't, about chemicals that are in products or that are used in particular applications, we don't have a general understanding. There's no sort of publicly accessible information about what is used in products and how that might be changing over time, how that chemical profile might be changing over time. But I'm thinking about so what that says to me is that as much as we can be looking across the board at different types of PFAS compounds, that might tell us something about exposure sources and what's happening. The example that I'm thinking of is sort of what we've seen in shifting patterns of use of phthalates and how that has been reflected in biomonitoring data, and how you can see action taking place on some phthalates, and then, with a little bit of lag, the concentration of replacement phthalates rises over time. And so we've seen that sort of play out in that switch from one chemical to another within a related class of compounds. But the only way that we're going to see that, of course, is by looking for a fairly wide range of the compounds. And there's such a long list with PFAS that's pretty daunting. But people who know more about which types of PFAS are used in which types of applications than I do could probably help inform some hypotheses about, well, if they're being eliminated from food contact materials, these are the chemicals that we might expect to see go down. And whereas, the legacy compounds that have very long half-lives, yes, those are declining over time, but maybe not as dramatically as when something is pulled from the market and it and the chemicals have shorter half-lives. So I don't have the details to fill in the substance of what that recommendation would be, but that's the approach that I would think about, is all of the information that you can get on which types of PFAS are used in particular applications that are under scrutiny, or that there's action being taken on, like food service ware. And I know that's all really difficult information to obtain. Ulrika.
Actually, the last thing that you just said was essentially the direction that I was going in also, which is that this, the effort to remove PFAS from food contact materials provides an opportunity to see, whether that intervention actually results in reductions in exposure levels over time. But we need to know what are the PFAS that are in food contact materials. And it sounds like from some of the presentations that we heard today, we don't necessarily know that. And so there may need to be two research initiatives happening at the same time to better understand what's in those, what's currently being used. And then if they're taken out, to be able to try to follow the trends over time and see if there's a reduction in biomonitor concentrations of those particular PFASs.
Go ahead, Narissa.
I was just going to say that, it's important to have a comparison group as well, just because we have overall downward trends. So maybe there's an opportunity where there's some municipalities that are being more progressive with reduction in food packaging to compare, to do surveillance in different communities. Just because otherwise you're looking at it in this overall context and you have lots of different changes happening over time, and it's difficult to interpret.
Yeah, I really hear that. And probably the only time to do that is in the kind of liminal space when there are changes being made, and there will actually be differences in various markets, because once large areas like the state of California do something to eliminate the use of PFAS in a whole product category, ultimately that will trickle down to the rest of the market. But at the beginning of a shift like that, there's going to be differences. And the tricky thing is to be responsive, to be able to do anything either fast enough to capture a change like that, or, that's the point of surveillance, right? Is that if you're measuring consistent substances over time, you're already measuring them. And so you can look back and see these changes reflected or try to understand them. But it's hard if if you don't have the capacity for that level of surveillance.
And it does take a certain nimbleness to be able to go out and grab the samples, but that is one of the ways MAMAs, or the biobank samples, are well suited, where you can get retroactive samples. We could go back to the San Francisco area and look over a particular time period in comparison to other places. And I thought of that also when Kate was talking about the Santa Ana area and the interventions in Orange County with their water supply in 2020. We could go back in time and then follow it up prospectively to see how those levels are dropping compared to the other parts of the state. I know I keep adding stuff to things we could do, which is not the point, but there are so many questions we're trying to answer.
I want to just flag that Simona Balan has mentioned in the Q&A that we do know what's used in food packaging because the chemicals are listed in FDA's food contact notifications database, but we don't know all the impurities and the degradants of those PFAS. So to add that to the conversation. I want to turn to Carl Palmer next and just remind folks to lower their hand if you would, so that I can keep track of who else needs to speak.
Thanks, Meg. Yeah, I'll just, to riff on what Simona pointed out, is that I think there are potential strategic opportunities to look at partnering with other regulatory bodies. We know what food contact notifications are required. We also know that CalRecycle has implemented certain restrictions on PFAS in food and packaging used at state facilities. So there might be an opportunity to find a cohort of people that ostensibly will be having reduced exposure to certain kinds of packaging. And so those kinds of things, kudos to the biomonitoring staff who work really hard to leverage their limited resources with the other agencies, but I think there's opportunities to expand that and to find potential opportunities there that could perhaps get good data.
Great. Veena.
Thank you. Maybe this doesn't make any sense, but I wondered about looking at the populations that have very low PFAS exposures and seeing if there's information there that could kind of speak to what might be helpful in reducing PFAS exposures. So, I'm just making this up, right? But like maybe a vegan diet, or people that don't eat fast food at all, or use very few personal care products. Because I think both types of information, both trying to really understand the sources of exposures for the kind of populations with the highest exposures, as well as what kind of behaviors or actions might prevent exposures. Both kinds of information are useful. So just a thought.
Go ahead, Kathleen.
I love that suggestion, Veena, because we've partly already done it. We had, in addition to asking about people's individual food item frequencies, we try to ask them about different types of diets. And in the ACE study, we also asked about dietary changes over time. Not an initial smoking gun, I'm afraid, for sort of vegetarian or vegan in the care population, though. I had held out hope for it.
So maybe I'll just point us back to some of the other questions. We've sort of been talking about general opportunities or priorities, how biomonitoring California data that exists or that could be gathered would support PFAS exposure reduction efforts. And so just to return to some of the other questions, maybe to highlight one potential for doing additional analyses on the existing data sets. And although we talked for a minute about the sort of racial separation of some of the results with the PFAS data that Kathleen presented this morning. Another question was about potential limitations and confounders with the GDSP biobank data used for the Pregnant Women in the Mamas Project, and what we might recommend to keep in mind with that. Another is questions about designing PFAS exposure questionnaires or other ways of evaluating PFAS exposure sources. Kathleen, are you still wanting to say something? No. Okay. Any feedback from the panelists on those questions? Jose.
When it comes to the race ethnicity piece, in many ways now that's considered more of a social construct than really a truly genetic one when we're looking at differences in just about any health outcome, with maybe some rare exceptions, but overall in that sense. But I think the findings that were presented today about very substantial differences, maybe somebody can remind me how much higher the concentrations were for some of the PFAS for Asians compared to some of the other groups. From what I recall, it was something like 80%. Is that right for some of them?
It depends on the comparison, but yeah, 144% was the highest, you know, when you're going, you know, comparing the highest group Asians down to the lowest group, which were Black participants.
So I mean, I see that as a
slides. I'm happy to pull up any slides anyone would like to see again, if you would like me to.
Well, thank you, Kathleen. But I think that I think overall there were some pretty stark differences for many of the PFAS being substantially higher among Asians compared to most other groups. And so I think that gives this window of opportunity of starting to get a little bit deeper than that. It's really more of a behavioral environmental difference there. And if we're talking about 140% difference for some of these, there's something important that one group is doing that the other ones are not when it comes to getting exposures to a lot of these compounds. Of course, PFAS are present in so many, there's just so many sources that it's hard to even be able to fathom constructing a very thorough or all-encompassing survey for identifying the sources. But I think this is one of those particular settings in which we might be able to get a little more of a straightforward answer, given these stark differences across these constructs, these groups. So that's something worth looking at. Also, we can't really say Asians and say it's all a homogeneous group, obviously. And so from there, it's parsing it out, right? So do you have any information about the subgroups within the different Asian populations, in which that might be another way to even start getting a little bit closer to what some behavioral or environmental differences there may be?
If I might add directly to this question, you know, I also find these kinds of ethnicities, asking people how they feel, it's a little outdated because many people say I'm mixed race anyway, and they feel more and more comfortable to tick that box, and it's actually true. So I wonder about that in terms of socioeconomic status, rather than, you know, their cultural and ethnic backgrounds. Do you have information about that? So it looked to me that these people were just eating more fish. And that one of the reasons could be because they're richer. I'm just making it up here as we go, but could be, right? And that is getting lost in that, you know, adding a label of some kind of ethnic background.
I definitely support that, and but I also remember that Kathleen showed us that those racial category differences persisted once fish consumption was controlled for. So it may still be what's driving it, not the fish, but it may be a socioeconomic a thing that's driving other sources of exposure also. But I completely agree with you that, you know, we all know that race is a social construct, not a biological determinant of health. And so the question is, what is it connected to? I mean, these are all the same question, right? Is like, what exposure source is that connected to? Kathleen, did you want to respond to something there? And then I'll get to Tom. Oh, no, hand down. Okay, Tom, go ahead, please.
Want me to go ahead?
Sure, I think I misread Kathleen putting her hand down, but please, you go ahead, Tom, and then Kathleen.
So PFAS is, I think it's pretty interesting group of compounds, at least the legacy ones. It seems to increase with socioeconomic position, contrary to lots of things. And that suggests that it's, again, it's not the biology of race. This is like where environmental epidemiology and social epidemiology intersect, that people have more income and so they have different purchasing, and maybe it's you buy carpet, or your diet is different, or you eat more fast food, or I don't know. It's all sorts of things going on there. And I mean, you know, NHANES does have some pretty nice data on socioeconomic status that they managed to collect that I think makes a pretty good case that that's an important variable for PFAS. I don't know what California Biomonitoring has for that, but I'm sure that's part of it.
Sorry to have skipped over you there, Kathleen. Please go ahead.
I think I hit the lower hand instead of the mute or unmute. Thank you for making the point that, yes, we didn't see the contribution, and that's in kind of quotation marks, contribution by race disappear with the addition of fish into our models. So there's still more to this relationship to uncover, and I won't claim that we have plumbed it completely. One additional piece of information that is good to know about the CARE study is that in relation to law changes, even though I presented these as, you know, very simplistic categories of racial ethnic identifications, we did allow everybody to identify in as many categories as they agreed with their background. So of course, for analysis purposes, you know, sometimes you do have to then take various simplifications, but we do have that underlying information so that we can look at things in different ways going forward. And I would say our income data is, we had let that be an optional category, so we don't have that for the entire data sets. We do have education. Of course, these aren't completely correlated, of course, but give you extra information about socioeconomic status. And at least for education, usually it drops out of the model once you put age, sex, and race into it for many of the compounds, not for PFNA, but for the others.
Thanks, Kathleen. Jose, were you wanting to join back in?
No, oh, sorry, my hand should have been lowered, but.
Okay, thanks then, Tom.
I was just going to say that I think this is where, you know, economic theory epidemiologic theory can actually help us, because dietary exposure is going to be a poorly measured variable, because it's what you've eaten over the last 5 to 10 years that matters for the persistent PFAS, not what you ate yesterday. So it all depends on, you know, if you use, so this comes up in NHANES, that if you use food frequency questionnaires, whether you use dietary surveys and all that sort of stuff. But the point is that a poorly measured confounder will not fully control for confounding, right? And it can actually bias things in either direction. So it could be that, you know, we control for fish, but it doesn't fully remove the effect of fish, and so it's still there. So I'm not saying that's not the explanation. It's you know, it's hard. Diet is sort of notoriously hard to measure. In fact, I'm always surprised that we see any relationship with dietary questionnaires.
Marissa?
I just wanted to say that these are all great points about race and the questions that we still have remaining. And it could be that the ACE data set is one of the places we should be looking for some of these analyses. ACE, of course, the impetus for that was because we did want to understand why Asians were higher in metals as well as PFASs. And it is an opportunity for us to look at, Asians is a very heterogeneous group. We were able to look at Chinese and Vietnamese, and it would be great to get more information with robust numbers to be able to look at these subcategories of Asians in a way. We do struggle with the homogeneity of some of the answers because everyone ate a lot of rice and fish in that group. But we have sufficient numbers and we have a lot of detail on diet that we just are not able to include in something like the CARE study.
Thanks. Kathleen.
I just wanted to add on to that point of Narissa's. So the ACE study looked at Chinese Americans in the San Francisco area in 1 year, and the subsequent year was in Vietnamese Americans in the San Jose area. And back to the point about sort of chemometrics and PFAS profiles, they did have different profiles between the two. And I haven't been able to move beyond sort of recognizing that the patterns were different there. But I think it's a good, promising arena that we could explore more.
Well, in that sense, if I can chime in, so if there was a year difference and location difference from where the two different groups were located, of course, that adds a lot of new variables to that, right? So we're talking about temporal changes and geographical effects too, and maybe not necessarily fully behavioral differences or otherwise across the different groups. Of course, it would have been ideal to have intermixed at the same time, ideally somewhere around the same areas where both groups or multiple groups were collected. So, that's just adding additional levels of complexity to disentangling, I guess, the differences.
Maybe I will take this moment to do our sort of formal call for public comment. I think it's been understood that participants and anyone in the audience can raise a question or provide a comment, but I want to remind you that you can use the raise hand feature in the Zoom webinar or send an email to biomonitoring@oeha.ca.gov or type a question into the Q&A function on Zoom. So I just want to check in with staff and see if there's any public comment that we haven't tended to.
There's no emails.
Okay.
And no hands raised.
Thank you, Cheryl and Shobha. Kathleen.
Apologize, I keep not tending to it.
Maybe there's a sort of call to folks for other kind of nominations for other potential sources of exposure around which we might see differential exposure that would help us understand exposure sources, like we've already talked about the elimination of PFAS from food contact materials or food service ware, and to flag any other ideas like that for the program. Jenny.
Hi, we have such experts among us. I'm hoping that we could hear, especially I'm interested in occupational exposures. It seems like this is an exposure that might be very prevalent. Firefighters, military bases, or people that live on military bases. airports. I'm just wondering if you have any comments on occupations which would be important to study.
If I understand you right, Jenny, you're asking for comments from any of our expert speakers who have contributed today.
Yes, I just thought what a great opportunity to get advice about how we should do from them.
Yes, absolutely.
I have to say, my experience with PFAS and occupational exposure is really chemical workers, the fluoropolymer facilities. So, I mean, I would expect that there might be some difference with firefighters and maybe I don't know, these chrome plating things. I've never done any work on that, but that sounds like that would be worth looking at. There are a lot of them. And I actually, off the top of my head, I don't know if anyone's actually looked at that.
Maybe I'll just add on to what Tom said there. We also looked at firefighter dust in the same study that I referenced, looking at the household dust. And there we did find higher levels of a lot of those compounds in dust and fire stations, indicating some occupational or potential for occupational exposure there. Now it's the dust, and I showed you that maybe dust isn't the most important exposure, but I think you might expect a similar pattern there. And certainly, just given the use of these compounds in AFFF, or also firefighting gear, you might expect that exposure there. So I think there are studies looking into that now, so you might expect that as well. Like Tom, I don't know about anything with the pleating industry, although that's an interesting question too.
And I actually, sorry, go ahead.
No, go ahead.
Well, I was kind of unfairly going to ask another question.
That's okay. Carry on. Well, yep. Go ahead.
It made me think. I don't know if anyone's looked at food workers, people who work in fast food restaurants or in the food processing industry. I don't know if anyone's actually ever looked at that. So I don't know how much exposure there would be, because I think a lot of the food contact materials are actually polymer based. And so you might have residuals, and so it's going to be complicated, and there's lots of them and they're hard to measure, right? So
I just might add that, this is one of the challenges we have when we're looking at certain consumer products that contain the materials. Once you know that they're there, then you can start breaking down how they get there in the process that they're manufacturing. Food packaging is a good example. Food packaging is generally a combination of a lot of different materials, sometimes with multiple people in the supply chain. And so, for example, some of the fiber-based food packaging uses mold releasers that contain PFAS. I'm not sure if those are sprayed on and there's someone there spraying it, or if it's automated and what workers, but that's one of the challenges, not only where are these chemicals in the products, but how are they actually manufactured, which would speak to the role of workers. But certainly platers are a good example of someone who there's probably a good chance they're exposed.
Another one that might be worth looking at would be, people who work in places that sell carpet, if the carpet's treated. Carl, do you know if anyone has done that? I mean, I know this has been done with things like flame retardants in the past. But I don't
know, and Simona might have a better idea. She led our PFAS team, but we did, when we were looking at these treatment products, for example, you can purchase a piece of furniture that is not treated, and then when you buy it, they say, would you like the treatment? And so we don't know if there's some poor guy on the back loading dock who's spraying it, or if it's done at a factory on order and things like that. So those are certainly good questions.
My second, somewhat unrelated question, but you brought up the dust issue again, Dr. Hoffman. And I was just wondering that even though dust might not be as correlated to the body burden as air levels, I'm wondering it could still be serving as a reservoir, and that the variability in air levels could be, the reservoir partitioning into air plus ventilation in the home leading to air levels or something like that. I'm just kind of curious if there's any thought that dust could be a reservoir, because it certainly has a lot of stuff in it.
Yeah, definitely. And I mean, I want to make really clear too that, we looked at a limited set, right? And so dust might be really important for some other things. And that's part of the hard part of understanding these compounds. We're going to get some that are going to be really important in air and some that are going to be more important in dust. So I think that's an important point. And you're right, you're going to get this kind of equilibrium and partitioning between the two. And you may see that sort of as a reservoir for what's coming into air as well.
Thanks, Ulrika. And then I have a question from the Q&A from a participant.
Thanks. Yeah, I just had a couple of comments. One, apropos of firefighters, I know one of the questions that the program was asking us was whether there are additional measurements that would potentially could be made in some of the archived samples from prior Biomonitoring California studies. And I know in the FOX study, which is the firefighter occupational health, occupational exposures study, the smaller original kind of group of 12 PFAS was measured. And I think it might be worth looking at the expanded set of PFAS in those samples, because dust was in a subset of the fire stations in that study. I know that the PFAS were also measured in dust, as I recall. So that might be, I mean, it would be a while ago. So you're going to be talking more about historical exposures in firefighters, but that might be an opportunity to use existing samples from the program's archives. And the other thing, apropos, I noticed, I recall that there was a study that was done by the program where people were replacing their upholstery, and it was looking at flame retardant biomonitoring levels. But I wonder whether that study might be an opportunity to look at the effects of that on PFAS. Now, I don't remember how long, what the time interval was with these longer lived compounds. It might be too short, but that might be another thing to think about. And, an intervention study that was done that might be informative.
Thank you, Ulrika. While we're on the topic of occupational categories, I'll just add 2 comments from the question and answer. Simona Balan says that there were some studies of air monitoring in carpet stores, but not in California. And I'll also add that I just know of a doctoral student who was trying to measure exposure to carpet recycling workers in California, because we have a mandate for carpet recycling, and wasn't able to gain access to the facility. So that's a potentially highly exposed occupational category. Just want to say that's my own comment. And Anna Reed comments that some other occupational exposures that may be of interest include ski areas. I assume that's like people who are doing ski waxes, car washes, and cleaners who are like janitors, I assume here, because of floor waxes. And I'll add to that maybe just that it's so tricky because all of those uses of PFAS intensive materials also involve environmental contamination with those products. And so teasing out what gets into the environment and what gets into the workers can be tricky. Tom, did you have something to add?
Oh yeah, there's definitely been work done on ski waxers in Scandinavia. There's been several very good studies. They have very high exposure.
Presumably because they're applying it with heat.
Absolutely.
And there's
in little tiny, not very well ventilated rooms, and Right. Although I think that stuff they're taking it out of the wax for professional competitions now, I believe.
I have a question from Summer Solstice Thomas from Silent Spring Institute. Has it been considered, so this is sort of getting to the point of questionnaires, has it been considered the importance of asking individuals the date of their most recent menstrual cycle when taking blood samples for PFAS biomonitoring? Has Biomonitoring California looked at PFAS levels in breast milk? So that's 2 questions, one specifically for the program about breast milk, and another more generally about the role of asking for date of last menstrual cycle.
This is Kathleen Atfield. As far as breast milk, at least for the studies that the design of the study is conducted by Biomonitoring California, we haven't measured any breast milk, I believe. I can't speak for our lab collaborations. And no, we have not asked about most recent menstrual cycle. What we have, the relevant information is mostly about related to age and to parity that we have for various studies.
Parity is huge.
And Tom, you're saying that because levels decline with increasing parity?
Absolutely. I mean, I think that's very well established in the literature now.
Is that independent of breastfeeding?
Connected to breastfeeding, but I believe it's independent. Although I can't swear by that, and I'd have to look.
And I should add, we have months of breastfeeding as well for the care studies, at least.
I have June, Sue, and then Sarah.
Yeah, just quick comment because you guys talked about the SKUX. Actually, Anna Kaman was the one, her group and her former advisor did a lot of work on the SKUX, the worker for the PFAS exposure. I just want to comment that. Since I opened my microphone, I also like to make a quick comment toward Jose's earlier concern about the background. To our experience, by far, PFAS background, the came mainly from our instrument. When we purchased and installed, purchased a new instrument and installed it, it took us a long time to get that background levels down, even after we replaced all the Teflon liners. That's what's happening to our new instrument just installed. We had a 6,2 fluorothalum sulfonate background, which is gradually coming down, but it just takes time like our old instrument. But we know all the tested tubes we tested has a little background was because I just realized we published the paper. The result we tested the serum separation tube compared to the lead dot tube we historically used for the blood collection and analysis. So I think I can forward that publication to you. That's the 2014 ones. Thank you.
So Meg, I just wanted to chime in and say it's almost 4:05, which means we have very little time left in the discussion. However, I can tell you that the plan for the 2022 SGP meetings is extremely short. So you could consider, that we cover that and then you come back and close up this discussion. So think about if that feels right, because I don't think we're going to have time to close up this discussion very well or address some of the other questions. And actually, I was raising my hand to answer the other question that Simona posed, which is Biomonitoring California considering updating its PFAS definition to match the revised definition from OECD? We have not at this point, and that would actually be an SGP decision. Now, you all may recall that I did raise potentially expanding and looking at more fluorinated compounds as a past possible chemical selection title, and that was not of interest to the SGP. But if the panel is interested in reconsidering the definition, that's something that we could bring for your consideration at a future meeting.
Narissa.
Thanks. I just wanted to address Ulrika's comment about using archived samples to go back and look historically at PFASs. A reminder that when we do any analyses on old samples, we are obligated to then return the results to participants. And so that triggers another concern, which is that people have signed up for a study maybe years ago, and so returning results to them, maybe coming to them out of a little context. And so it's something that we always consider when going back. We have done that with the FOX participants, going back to look at another class of flame retardants. And so there's some precedence for it, but the MAMAs also does offer the same kind of benefit in terms of being able to do historical profiles of PFASs, and in that way also we can get more of a surveillance type of data rather than a particular cohort that we would have recruited to the study. And because we are coming to the end of the time, I just want to put in a plug again. We've talked a little bit about collaborations. We've talked about more types of analyses than the program can do on our own. And so inviting all of you to think about students who might be interested in doing this kind of work. We have lots of data sets. And I think Cheryl or Sarah will also post the links to our positions available in Biomonitoring California, because if there are people listening who would like to come work on some of these questions, we are looking for good EPIs.
I have a question about that, Narissa, of how to better matchmake between the needs for data analysis that the program has and the rich data sources that are here, and you know, the very spread out, diffuse sort of placement of doctoral students and working with researchers in different universities all around. And I've been kind of mulling it over all day, but I wonder if there's if we could think through some kind of format that is not too burdensome for the program, like putting together a short slide deck that would illustrate some of the opportunities that there are that could be circulated, or if there could be one webinar held that everybody could tune into, so it wouldn't have to be a outreach to individual schools of public health or like that, I have the sense that we could do more to proactively kind of speed up that matchmaking.
I think that's a great idea. We have started down that road, kind of coalescing all this data of, like, you know, who's in the study, what panels do we measure, what are the kinds of questions we've asked, and we do have that in a database. I think there's another step to that which we have done for CARE, where we've started to just do a quick analysis of, you know, who answered this question and what kind of variability are we seeing. So these are the questions that will be useful for some kind of analyses. So it's quite an effort to go back and do that, but I think it's one of those things on our to-do list that we want to come out with this menu so that we can say, you know, here's what's available to you researchers, and what are questions that you might want to be interrogating our data for.
Great, thank you. At this point, I want to pass it over to Sarah, and as she mentioned, if we move through the next part of the meeting quickly, and I'll check in at the end of Sarah's presentation if there's sort of unfinished business from this discussion that we can reopen before we close the meeting. So I want to pass it over to Sarah for the plan for the 2022 Scientific Guidance Panel meetings. Sarah Hoover is Chief of the Safer Alternatives Assessment and Biomonitoring section in OEHA, and she'll provide a brief overview of that plan.
Thank you, Meg. And I will also add that after I finish my brief presentation, we could also call for open public comment, and then you could clear both the items and turn back to this discussion if that seems reasonable. Okay, I'm going to give this a shot. My first try in, let's see now, this is interesting. I have it open. Okay, I'm just going to share my screen and navigate to my PowerPoint. Let's see, slideshow from beginning. Okay, can everyone see this?
We're still seeing your, I think, team screen.
Okay, this is why we practice ahead. Okay, let me stop sharing. And so Elizabeth, when I picked the share screen, it did not give me, okay, now it's giving me the PowerPoint option. All right, let's try that. Okay.
And now we see your PowerPoint.
There you see it. Fantastic. It wasn't, that window is not coming up. Okay, really briefly. Normally, every November, we talk about possible topics for the next year's meetings. And in conferring with my team, with Narissa's team, with other program leads, with our management, we realized that we want to take a simpler approach in 2022 for a number of reasons. And those reasons are, number one, my team at OEHA, we're spending our time on AB 617 biomonitoring. We're launching the Stockton project this week, and we're also going to be working on another project in the coming year. Meanwhile, at CDPH and DTSC, they're busy working on implementing the new budget augmentation and hiring people. So we just realized we have to go back to a simpler model. So to start with, thank you to the panel members for responding to a couple of surveys. We pinned down our 3 dates for next year. They're all going to be half-day meetings from 1 to 4 p.m. on March 25th, July 22nd, and November 18th, and those are all Fridays. Fortunately, even though the Bagley-Keene exemption of not having to meet in person is going to expire, at this moment it's slated to expire in January. However, given the nature of the meetings we're having, we're still going to be able to have attendees and panel members join via Zoom webinar. We will set up a meeting room for each meeting in case the public wants to come to a meeting room where they will then watch the webinar. So we're just planning to have a very simple standing agenda for all 3 meetings where Narissa would give her program update, Susan Hurley would give the AB 617 biomonitoring update, and then we'd really just have an open discussion with panel members, program staff, and the audience about whatever issues we're confronting in our work at that time. Then we'd also make sure to have some dedicated time for specific panel input as well as public comment. And that's the plan for 2022. I also want to remind everybody on this call and in general that it's always possible to submit public comment on any topic to the program, to our program email. So I'll just stop there and see if, before I close the slides, if anybody has any questions about this plan for me, either from the panel or the audience. And any comments about the plan, or seems reasonable? I should add, I'm sorry, I should add one other thing, which is that if there were a specific topic that came up, we could always consider scheduling that. So this is the standing agenda, but we're not banning the possibility of talking about other things. Something might come up that we all feel is important to address.
Tom, you had a question or a comment?
Yeah, brief question. So it sounds like these are going to be a hybrid meeting where there'll be a room.
Exactly. It's
And
the
then,
I'm
so
calling it
are
the hybrid model.
And the panel members do have the option. I mean, if it's easy to get there, if it's local, like over in Richmond.
Sure. Yeah, I think what we probably would do is set up a room in the Oakland building of OEHA. And yeah, absolutely. Panel members would be welcome to join there.
Would, as results continue to kind of come out from analysis of care and things like that, is that what would be included in the program update? Would that be a chance to sort of see some snapshots into that?
Yeah, definitely. Okay, well, I don't see any other questions. Cheryl or Shoba, are there any public questions or comments on this?
I'm not seeing any attendee hands up, no.
Yeah, and I don't see any new emails.
Okay, great. So again, if anybody does think of something later, feel free to email us. And that is the end of that presentation. Thank you very much.
Great, thank you, Sarah. And I just want to, it's sort of like a good moment to note the tremendous amount of effort that goes into preparing these really rich and informative meetings on the part of the staff of Biomonitoring California and all of our guest presenters and discussants. And I think we've all benefited enormously from that, but that it's also important to recognize how much work they are, and it'll be interesting to try on for size this new format that hopefully will reduce the burden a bit on staff, and let's see how what kinds of meetings it produces, and we can go from there. Carl Craner, did you have a question or a comment? Carl, were you going to make a comment or no?
Yes, I was muted. These were great presentations and efficient. Thank you.
Great. Tom Webster, that is.
Oh, hi. Yeah, I wanted to comment a little bit on expanding the definition. So like I said before, I have one of my PhD students is looking at the different definitions, and in particular with the implications they have for organofluorine, pharmaceuticals, and pesticides. And I'm not saying it's a good or a bad thing, but one of the consequences of going to the OECD the new OECD definition is you would pull in a large number of high volume fluorinated pharmaceuticals, and that's going to cause IRB problems. So just be aware, if you do it, have your eyes open.
So I want to say something about the rest of the meeting. We have 15 minutes if we need it. And there's a few things that we need to do during that time. One is I want to open public comment. We have 10 minutes allotted for the public comment period. And this is an opportunity to comment on any topic related to biomonitoring California. It doesn't have to be constrained to the topic of today's meeting. And a reminder that if you're attending via webinar, you can submit written comments or questions in the Q&A function or by email to biomonitoring@oeha.ca.gov. You can raise your hand via the Zoom function and we'll call on you to speak your comment. There's two comments that I want to flag that were posted on, or links to which are available on the November meeting page under the open public comment section. And those are both by Dr. Himsa Porter Sumchai of the Hunters Point Community Biomonitoring Program. And that commenter submitted two links. One is called Unraveling the Breast Cancer Conundrum in San Francisco, and the other is a Biomonitoring Saves a Life. And so both of those public comments are available by links from the website. And then a third comment that was emailed to the program is just following up. It's from Cheryl Patton and just following up on a comment dropped in the Q&A about the two pesticides that contain PFAS. And the details, the comment includes the details on those two pesticides, and Biomonitoring California has that information now. So rather than share all the content, I just want to refer to it. So that's to acknowledge the three public comments that have come in, and I want to pause for a moment to see if there are any public comments submitted by email. I don't see any attendees with hands raised or anything in the Q&A.
There are no new emails.
Okay. So aside from assuming that we don't have to wait, there's no lag in submitting public comments. The only remaining thing that we have is if there's additional comment and discussion from our discussion period that we didn't get to before the time came for Sarah's presentation about meetings in 2022. So I want to leave a moment here for any panelists or attendees to raise hands or drop a comment or question in the Q&A before we adjourn the meeting. Any thoughts that discussion triggered around the topic of PFAS and how Biomonitoring California can contribute to understanding sources of PFAS and how to reduce exposures? Sarah.
Yeah, I'll just chime in briefly since no one else is. I am curious about the panel's take on the possibility of expanding the definition. As I said, I've raised the issue of considering other fluorinated compounds. I have not been an advocate for expanding the definition, in part because of the cautions that Tom Webster raised, but I would be interested to hear the panel's thoughts on that particular question.
anyone have contributions to that at this moment? Jenny, did you have something?
Just to say I agree with Dr. Webster.
And that's about the complication of
about the complications and maybe getting too diffuse as well.
It's reminiscent to me of the difficulties that arise around non-targeted screening and how to handle illicit substances and or prescription substances, pharmaceuticals, and all of that. It's a little bit reminiscent of that. Vina.
My thoughts are that I think we just want to make sure that the current definition does capture all of the PFAS that could be of interest related to the kind of exposure types and sources we're interested in, including some of the components that go into fluoropolymers. And I think it would be worthwhile to just take a little bit of a closer look at that question in terms of the definition. And that certainly the listing could be written in a way to exclude pharmaceuticals, if that's not of interest. Similar to how halogenated organic chemicals used as flame retardants is very specific to chemicals used as flame retardants.
Yeah, that's something I've appreciated about the program's class definitions is that they haven't been like strictly, they've managed to span that distance between, like, is it strictly a sort of molecular definition, or is it also a use definition? And I've appreciated how the program has kind of spanned that divide in the past. Maybe it's just a vote of confidence for the program's capacity to do that. Sarah, did you have a comment?
Yeah, if I can just chime in to say that I will take note of that suggestion. And I'm actually really interested in this question. I've been looking at it a lot. I know Tom's been looking at it a lot. So I'll plan to take a closer look and see, because I agree, there are some things that are missed through the bucket all definition, but there might be another way to handle that rather than changing. I mean, I've resisted changing that definition because that is the definition that established the class of PFASs. So my idea would be to instead, well, is there another group of fluorinated compounds that we want to bring in, and what would be the best way to do that? So why don't I go back to that, taking a look at that. I'll confer with Tom and others about it, and we'll just at some point report back on what we found. Does that sound good? Is that
That's
okay?
great.
Okay, great.
Tom Webster, did you have a comment?
Oh, yeah, I was going to say that I actually really like what she just said, that I don't think the buck definition is really comprehensive enough for what you want, but you need to think hard about what is it that your organization wants to get out. That's the point about a definition, is what's the purpose of it. And you probably don't want to include fluorinated pharmaceuticals. I don't think that makes a lot of sense for you, but you might want to include, liquid crystal monomers, for example, if people might be exposed. I don't know. I think it's worth sort of thinking about fairly seriously.
Thank you, Jenny.
Was Sarah ahead of me to make a comment?
I think Sarah made her comment.
Oh, okay. I was hoping I could make a really quick open public comment and then for something for maybe another session to discuss.
Sure, and but you can make a comment at any time.
Okay, well, I can hold it if you want to wrap up the meeting.
Good. Now is good.
Okay, I just want to throw out for a future discussion for our guidance panel that we think about if we want to stick with pure biomarkers of exposure because of a recent study in our updates where we might be looking at biomarkers of early genetic damage, for example, which is kind of a departure for the study for our program to look at anything but biomarkers of pure exposure. So I just want to throw that out there that we might want to have a discussion about it.
Can I chime in on that, Meg?
Yeah.
So just to clarify, Jenny, if you're referring to the AB 617 study, remember that that study spans, it goes beyond just biomonitoring California. So we're funded to support the AB 617 mandate. The biomonitoring, the exposure biomonitoring is run under Biomonitoring California, but we have other funding. So I wouldn't say that we're actually expanding in biomonitoring California beyond what we've traditionally done. I don't know if that's helpful. I will also note that technically, in terms of our purview, we can choose whatever biomarkers we think are reasonable as indicators of exposures to chemicals on the designated list, for example. So that's another way to look at it.
Don't want to take up too much time, and just for another meeting, perhaps.
Great. And Jenny, did you have an additional comment?
Me? No, sorry, my dog's barking.
It's okay. I thought you said you'd had two. No worries. Okay. I don't see any other hands raised, but now's the moment if anyone has any last contributions before we wrap up the meeting. In that case, I will do the final announcement that the transcript of this meeting will be posted as usual on the Biomonitoring California website when it's available. Our next meeting, as Sarah mentioned, will be on March 25th, 2022 from 1 to 4 p.m. and attendees will be able to join via Zoom webinar or at a meeting room that will be announced. I want to thank Biomonitoring California staff for putting together this meeting. I want to thank all the presenters who brought such rich content to the discussion, and all of the audience members who participated, and of course to the panel, with a especially hearty thank you to Vina for everything that you have contributed to our conversations over the past few years, more than that, while you've been a member of the panel. And I understand you'll still be involved, but I'll just be sorry not to have you as a fellow panelist here. But thank you so much for everything that you've brought to the program. And with that, I'll adjourn the meeting and we'll see you in March.